Hello everyone, my name is Macie Camardelle, and I'll be presenting on the topic information technology in the clinical setting, and I will be specifically talking about the electronic health record and other types of technology used in healthcare. First, I'm going to talk about the basics of technology. So my first point says technology expanding in healthcare. So technology is becoming more useful in the healthcare system, and it gives us a way to see information in a different light. For example, you can see trends and vital signs on the electronic medical record. My second point says patient data modified. So that just means that data is modified into one patient record so that all different healthcare professionals can view it. And my third point is distributing information. So that just means that the data is shared much easier. My fourth point says greater opportunities. So there's more opportunities for things like networking, education, and disaster response. Now I'm going to talk about the electronic health record. My first point is data capture. So that's different ways information can be put into the EHR. And the origin of the data can also be from people other than the patient or even from patient monitoring devices. My second point is storage. So that's where the data is located. And there are specific spots for different types of data that needs to be easily accessible since it's distributed to other healthcare professionals. My third point is information processing, and this is very important because the EHR can give alerts for drug interactions, allergies, and abnormal lab results, and it could even send reminders for medication administration and appointments. My fourth point is information communication, and this is being able to operate and link systems to exchange data in the EHR. And my fifth point is security, and this is a big deal in healthcare. This concept talks about keeping information confidential and only allowing people who are authorized to have access to the EHR. In the Q's and competencies attitudes section, it states that a patient's healthcare records should be kept confidential. Now I'm going to talk about some opportunities and barriers to the electronic health record. My first point says sharing records. So this can be effective in reducing stress on the patient because providers can look at previous diagnostic tests instead of repeating them. It also reduces cost for the patient. My second point is predicting outcomes. So this is done when providers look at data across systems to examine different trends. This helps them to see population, disease, or complication health outcomes. My third point says meeting guidelines is strenuous and costly. So a barrier to the EHR is that it can be costly and strenuous getting all employees to become efficient in using it. You also have to update it every so often. Now I'm going to talk about other types of technology that's used in healthcare besides the electronic health record. So my first point says health information technology at the bedside. So this is being used much more commonly now, and it's said to be necessary to deliver safe quality care. The BSN Essentials makes it clear that graduates are expected to come out of school with efficient knowledge in informatics and the EHR to be able to provide safe quality care to their patients. My second point says handheld computers, smartphones, and tablets, and these things are very convenient because of the quick access for patient education and care. My third point says computer memory versus human memory. So computer memory is obviously much more effective. If you think about it, our brains have to try to remember dozens of things during a workday, but computers store information that you always have readily available. They can also send alerts and reminders, something that our brains can often forget to do. And my fourth point says reducing drug error. So in a journal article by Matthew Grissinger, he says the implementation of information technology in medication use systems is widely accepted as a way to reduce adverse drug events by decreasing human error. To wrap up my PowerPoint, I would like to say that technology is becoming very popular in healthcare, and because of this, employees need to be efficient in using this new technology. And the most positive outcome of this is that healthcare professionals are able to better care for their patients. Question: do you think information technology in the clinical setting has helped employees practice in a more safe and effective way? How? If not, why?